Okay, good morning, it's Miss Rail, and I'm going to go over your next assignment. You're going to have this patient, and on the back of this patient information sheet is a lab slip. You're going to complete the lab slip. If you'll notice on the lab slip, for example, basic metabolic, it gives you the number for the test, and it also, if you keep going, it tells you what tube to draw, okay? You're going to mark the test that you want. Your name is here. You're going to use this information to complete the lab slip with the patient name, their demographic information, their ID, the physician's ID number. You're going to sign for the physician, and then you'll put / your name. That's how we identify that it was us signing for the physician. Then you have your new sheet of directions for this particular lab. This time we are drawing a butterfly, and so that's what I'm going to show you here in the video so that you will have it to be able to use. Okay, so step 1 is always wash my hands, gather my supplies. So for my supplies, I have my tourniquet, I have my gloves in the size that I wear. I have, same as last time at the beginning, gloves, alcohol pad, and then you're going to have your needle, which in this particular case is a butterfly needle. Then you're going to have your needle holder, which is a Vacutainer holder. The tubes that you will need based on the orders on your lab sheet, which are in the red lab container, and you're going to want to put them in the order of the draw so you know which order you're drawing them in. Now, because a butterfly has a long hose, you do need to have a tube before the blue one to get rid of the air. Okay, so I'm going to use a green for that, gauze, and of course tape. All right, so washing my hands, go in. Hi, my name's Jan. I'm going to be your nurse today, and I'm going to draw your blood. Can you tell me your name? Chad Whitney. Can you tell me your date of birth? 6/16/2008. I'm checking that with my orders. And then, do you have any allergies? No? Okay. I'm going to put the tourniquet on so that I can check your veins real quick. Tourniquet, same as you did it last time. I determined where I'm going to go. I'm going to go right here. Check a couple different spots, see if I see anything better. Nope, I like that. Take the tourniquet off because the most it can stay on is 1 minute. I've touched my patient, so I need to wash my hands again, and this time I can use the sanitizer. I'm going to put on my gloves. And remember, you don't want your gloves touching anything, so you're keeping your hands up and in front of you and not where you're going to drag the fingers on some equipment. I'm going to open my alcohol pad and clean my site. I immediately put stuff in the trash can right beside me. So now I'm going to clean 3, 4, 5, 6, 7, 8, and 9, and 10. I like to clean for a good 10 count. You'll see people that just go, well, that's not really clean. Then you pick up your Vacutainer needle, and you'll see that there's an arrow, and it's always at the opposite end of the needles. All needles items open at the opposite end of the needle. So I'm going to peel it apart, and I'm just preparing my equipment while that alcohol dries. I'm going to tear this off, but I'm going to keep my lid because I need that for documenting my needle size for my charting. I take my needle out, and I usually just take the plastic off, but I keep both pieces in my hand. Then I pick up the holder, and I need the small end of the holder to go onto the butterfly apparatus. The end with the blue has these wings, hence the name butterfly. Okay, I'm going to put all of this back in the tray because I want it to stay sterile. I don't want to take a chance of getting anything on the table. Now that I have my gloves on, I'm going to take my tape, pull my tape, and I'm going to stick it on the back of my gloved hand. You'll see people sticking tape everywhere, and that ends up getting germs. Now I'm going to pull up on my tourniquet. Cross. The one that's in the front is the one that I tuck. Okay? I'm going to pick up my needle, and you'll see that there's a bumps and no bumps. I want this bumpy side to be by my fingers because that gives a good grip. I take the needle cover with big hands and I pull. You want to just pull with big hands so you don't get a bounce back. This is my favorite needle because I can see the blood coming in this yellow. You want to hold the vein, whether it's with your thumb or a finger, doesn't matter, but you want it behind where you're accessing the vein. And if you hold with the bumps the right way, the bevel will always be up. Go in 45-degree angle. As soon as I go through the vein, I want to decrease my angle. Pick up my first tube, which is to just get some blood coming through so that I can draw a blue top tube. Now I'm going to put my blue top tube on. And with a blue top, you want to make sure that you fully draw it, that you don't leave any air or anything like that. Okay? So here's my blue top tube. And I rotate it, stick on my next tube, which in this particular case is a red top. Now, the way this is meant to be used is like this. I have these flanges on the side, and I can hold it up. If that's hard for you, you can do it this way on a table. Notice I have yet to let go of my right hand. 1, 2, 3, 4, 5, why that draws. Okay, I've got this one. I'm going to put on my next tube, which is my gold. All right, let it draw. Okay, it appears as though I have a little bit of a dud on that gold top. Okay. And then I got this tube. Then I'm going to do my last one, which is lavender. Okay. That one draws. You don't want to get air back in your tube. So another way, if you feel like they're slipping off, either get another tube, hold it, and you can also do all your tubes at the end. You need to pull the tube off before you take the needle out. You also need to remove your tourniquet. Then I'm going to pick up my gauze, pull my needle straight back. Then I'm going to ask my patient to hold it. This is the way I'm teaching you guys to do it. I can do it one-handed like this. You're going to open the wings. If you hold one wing, pull down on the wing and push up with the yellow. That is your needle securement device so that nobody will get poked, okay? I use the side of my hand, keep my pressure while I put that straight in my needle box. Get my tape, put my tape on, and I usually hold for another minute with my tape on, and then I pick up all my tubes and I rotate them all. 1, 2, 3, 4, 5. You do not want to shake tubes because they'll get foamy and it's difficult to run the test. You also want to make sure that your tubes are full, particularly a blue top tube. A blue top tube has these yellow lines. It needs to be to the top of the writing, okay, right to there. Not the where it says BD, but where it says sterile R, right there. Okay, if it's not, it's considered a short tube and they'll return it to you. Something like a gold top tube, same thing. The full line is right there. Some tubes, like this red, has a mark right there where it's full, and you don't have to fill it all the way up to the writing. It's just to that line. This tube is not full. Let me see if this one is. Nope. We've been having some dubbed tubes today, but you would want this one full up to that black line. It's a little bit short. I happen to know on a lavender they will likely take this and be able to run the test because they only use a couple of drops of the blood. They don't use the whole thing. Okay, so now I've finished. I will instruct my patient, leave this on for about 20 minutes. Unless they're on a blood thinner, then I'll tell them to keep it an hour. I do keep my slip to use for my documentation so I know what type and size of needle. Put that in the chart. That way if there was ever any recall, I would know. Tidy up my area. Throw away anything I'm not using. Okay. Remove the tourniquet totally from under the arm. And a tourniquet is considered a single-use item. And, oops, got my hand in the way here. That's it. If you have any questions, please let me know. Thanks, bye.